Hello, I'm Cindy Syrian with Community Medical Centers. Thank you for joining us for this edition of Community MedWatch. Tonight, the statistics regarding heart attacks are scary. 88 people suffer a heart attack every hour in this country, and according to the American Heart Association, about half of them will die. Now, there's a special technique done in the Valley only at Community Regional Medical Center that is giving doctors and patients another way to detect trouble and prevent those heart attacks. It's called the Transradial angiogram, and it's all in the wrist.
Okay, fine, good.
This is what your heart looks like through the lens of a tiny camera. Cardiologists use these images from an angiogram to find potential problems in heart patients. In the United States, most doctors are trained to insert the camera a certain way.
Most angiograms and angioplasties, where we put stents into the arteries, are done from the femoral arteries or from the groin procedure. But there is another way of doing these procedures.
Dr. John Ambrose is the director of cardiology at Community Regional Medical Center, where they are using an alternative entry point, the wrist area.
Here, we make a puncture in the radial artery, which again is right behind the thumb. It's typically where maybe someone might feel a pulse.
In the transradial, or wrist angiogram, the surgeon threads a wire and a catheter all the way up into the heart, where he can look for blockages or other problems.
Terrific. So we're into the artery.
Since the radial procedure uses a smaller artery, it reduces the chance of bleeding complications, and Dr. Ambrose says it tends to be much more comfortable for the patient.
When you get a patient that has had a femoral procedure or a groin procedure, and then he has a wrist procedure, I would say 100% of the time they say, oh my goodness, this is so much less painful.
It was great. It was a walk, you know.
Bobby Heidick is one of those patients who has had both the groin and wrist procedures, and after spending time on Dr. Ambrose's operating table, she swears by the transradial angiogram.
Deep breath. Good girl. Just keep it there.
Had to remember not to pick things up because I felt so good after that one. So there's just almost no comparison between the two.
After the groin procedure, patients have to lie flat on their backs for 6 to 8 hours, and in some cases may have to stay in the hospital overnight. Even after they get back on their feet, they must be extremely cautious about bleeding and deal with soreness for days.
It's very uncomfortable, and your groin area gets very sore. And of course your bruises are huge too.
But with this alternative method, patients can get up on their feet in the same day.
An individual comes in that day for the procedure and then leaves a few hours later.
Dr. Ambrose says only 1% of his patients experience pain when using the wrist as a point of entry. And according to a study in the British journal Heart, the transradial procedure reduces the need for blood transfusions by 50%.
And we now recognize that bleeding complications of these procedures is a very important cause of morbidity, and actually occasionally patients can die from significant bleeding complications.
But even with its advantages, Dr. Ambrose is the first physician performing the transradial procedure in the Central Valley and one of the few who use this method in California.
Unfortunately, it has not caught on in California. Yet on the East Coast, it's probably used maybe 70% of the time.
The surgery requires precision to get into the small radial artery, and surgeons need a lot of practice, but it's not part of the typical training. The number of doctors who can perform the procedure is growing, but slowly.
Even before I did it, I was reluctant to learn because I said, oh, it's a gimmick. But it's not a gimmick.
I would advise going through the wrist because you are more comfortable, and if your doctor is comfortable with it, I just think it's the best procedure.
Technology today is amazing, and it's a good thing. Heart disease is the #1 killer of men and women, but with tools like the transradial angiogram available today, some of these patients have a better chance of survival.